We're here today at the Hallamshire Physiotherapy Clinic with one of our specialist physiotherapists, Banu Ramaswamy, and we're going to be talking to her today about a special interest of hers, which is physiotherapy for older adults. So Banu, in general, people seem to be living longer these days, and that probably means that they need to stay fit and active for longer. So can you just give us some indication of how physiotherapy can be involved with that?
Physiotherapy is really useful for keeping people active. That's what we do. The one thing that happens as you age, our joints change, muscles change, the way we move changes. And what physiotherapists are adept at doing once they specialise is looking at the changes that occur in the different systems of your body and thinking about the impact that can have on someone so that they can actually work, exercise and make people do things about the changes that are occurring.
Okay, so what sort of conditions do you think you'd be involved with treating?
I think the most usual one is arthritis. And something like arthritis may just create pain or a change in the way someone moves. That affects how they then function around the house, getting in and out of a chair, bed, their general movement. But something like arthritis may also result in them having knee replacement or surgery for a hip. And as a consequence of that, people again learn to move wrongly or they don't regain their best movement. And I think physiotherapy is very good at dealing with making sure they return to their optimal movement.
Okay, we also hear a lot about older people having falls. Could you just briefly explain how physiotherapy can assist with patients who are having falls?
Usually balance is the main issue, or weakness in muscles, which also interacts with balance. So I think the physiotherapy assessment is there to look at whether someone has a condition that we can treat, so whether it is muscle related, nervous response related, bone and joint related, as opposed to something like vision or hearing, when we'd then still assess but refer them on for something else. And I think the physiotherapy treatments then really look into how those interplaying systems of your body help create problems with balance, and how we can then readjust them and teach someone to improve each of the systems so it returns, again bringing back the best balance they can gain.
Okay, so we're looking at maximising somebody's potential really
Yes.
in their levels of function.
Yeah.
So can you just tell us, just very briefly to finish, about, I know it's a special interest of yours, so about the qualifications that you've got that enable you to work within this field?
Yes. Years ago my master's degree was looking at first contact care, and that's a degree that enables you to look at the different medical conditions people may be diagnosed with and look at the impact one might have on another. But more specifically, it enables you to know the impact a condition won't have on another. And I think the moment you're given a label of arthritis, osteoporosis, fall, it affects our confidence, it affects our understanding of what we're capable of doing. And I think that's where my qualifications, I've also done extra exercise qualifications, and I think that's where they come into, their best, to ensure that we know about the different conditions and we know what a person's capable of despite having a medical label.
Okay, that's lovely, thank you. So if you'd like any more information about Banu's special interest in rehabilitation of older adults, then please don't hesitate to contact Hallamshire Physiotherapy. Thank you.